usually you don't get significant cognitive decline if you have been always eating a whole foods organic diet and exercising every day and sleeping well. And so the actual program includes many foundational aspects that's very functional medicine-esque. You have to eat the right things. Now, the biggest change in the diet is that you want to be in ketosis. And so if you want to optimize the health of your brain cells, you cannot eat carbohydrates and sugar. You want to get into ketosis. People are checking their ketone levels. We want a level of beta-hydroxybutyrate to know that you are doing everything you can to optimize the function, the energy and function of all of your brain cells. And so that's very difficult for people to look at that and be like, am I going to be able to change my diet enough to be in ketosis for the rest of my life?
Hey everyone, it's Josh Bellew here with Ultra Botanica and with Ultra Life Today. We have Dr. Royce Bargas with us, doctor of osteopathy, board certified cardiologist for this episode today. But we're going to take an interesting detour away from heart health because we're going to talk about something. You may have heard of someone called Dale Bredesen, Dr. Dale Bredesen, a neurologist. I think he's got 3 best-selling books out there. He's created a really cool program called Recode. Recode your brain. It's a protocol, and he's also trained people that are certified Bredesen Recode practitioners. Many of them are functional and integrative doctors, and Dr. Royce Bargas is one of those. So we're going to talk a bit today about Recode and cognitive decline, dementia, Alzheimer's, things like that. Is there hope for an individual to recode their brain no matter where they may be at? And Royce Bargas, always, it's awesome to have you here. I'm sure I'm going to be wowed by this information. I didn't even know till recently that you were a certified Dale Bredesen Recode practitioner. So
for a few years now.
I am stoked about this. Can you explain maybe the foundational principles behind Recode? Maybe how it differs, because I've heard a lot of different protocols recently. I've been studying brain health, heard a lot of different protocols and different approaches to doing this. What are the foundational principles, and how does this differ maybe from other programs that we've heard of out there?
Well, I would say if there are other programs that are a multifactorial lifestyle approach to cognitive decline, they're piggybacking off Dale Bredesen because he truly was the pioneer.
Really,
of all of this.
And how long? I'm just curious. Has he been just plugging away in this arena? I've heard of his name for almost 2 decades, I think.
Yeah. I can't remember when he published Patient Zero. I should have reviewed. I have a whole talk about this. I should have reviewed it for this.
No worries.
It's been a while. Been a while. And so he is an Ivy League trained neurologist who really has dedicated his entire career to Alzheimer's treatment. He believes that it is a reversible process or completely preventable disease. And he looks at Alzheimer's as like a leaky roof, which is very different than any sort of conventional pharmaceutical-based approach. And so for somebody to develop significant cognitive decline, a lot of things have to go wrong. And in the pharmaceutical world, you treat one thing. And that's why there has been probably over 250 drugs studied for Alzheimer's, and not a single one of them has made a very significant impact on the disease.
Oh my gosh.
Because they're each plugging one hole. And you can imagine if you have 35 holes in your roof and you successfully plug one, you still have 34 holes leaking in your roof and your house is getting very wet. And so his program looks to identify all the holes and plug them all as best as possible. And even if you can plug 30 of the 35 holes, you will have made a very significant impact on your cognition. And so examples of the holes are things we know that insult and stress the brain. And so he's developed coined 5 different subtypes of dementia. And this is sort of how the program is broken down into identification of the holes. And so there is inflammatory, as I've said 1,000 times, inflammation is the root of all evil. So there are inflammatory biomarkers and different things. Glycotoxicity, so that's glucose, inflammation from glucose, so basically metabolic dysfunction and high blood glucose. There's a reason why dementia has been coined type 3 diabetes. It is a sugar-driven disease. And then there's toxicity, which is toxins like heavy metals, mold, glyphosate, environmental toxins that we know damage brain cells and contribute to cognitive decline. And then there's atrophic, which are all the trophic factors that are necessary for the brain. Zinc, selenium, all the B vitamins, vitamin D, vitamin C, all the antioxidants, all of your hormones, estrogen, testosterone, progesterone, pregnenolone, DHEA, thyroid, all of those trophic factors that support optimal cognitive function. And then trauma, which is, you've heard of
that T word keeps coming up
trauma,
in our conversations, doesn't it?
Not trauma like emotional trauma, although I'm sure that's damaging for the brain, but this is specifically like head trauma, the concussions that, football players get, or motor vehicle accident.
Combat sports athletes.
Yeah. There's been a lot of media press about cognitive decline in ex-football players. It's a huge problem.
For a second, I want to go back as it relates to some of these holes, because you mentioned these 5 categories, 5 holes as you called them. That was great. Put a good picture in my mind. How does a practitioner go about determining which hole a person has?
You test, don't guess.
Okay.
And so the testing is pretty extensive through the Recode program. And to be clear, so Recode stands for Reversal of Cognitive Decline. And there's also a PRECODE program, which is much less intensive. That's Prevention of Cognitive Decline.
Beautiful.
So you don't have to have any element of cognitive decline to benefit from this program. And in fact, my favorite is the PRECODE. Like, get in before you have anything. If you've determined you have risk factors, if you have family history, if you have ApoE genotype, it's never too early, but it can definitely be too late. And so,
please give us a brief. And I interrupt you. I'm sorry. Go ahead. But I want you to tell us these different tests. And what you know
can't even
them.
list all the tests.
Okay, wow.
There are all the things that I mentioned when I'm talking about the different subtypes. We test all of those things.
Okay.
So all the cholesterol markers I've mentioned in earlier episodes, many metabolic markers, fasting insulin, triglycerides, all of the many essential elements, B vitamins, or vitamins in general. Many of them are B vitamins. We look for toxins. I do very extensive toxin testing. All the hormones, I want to know that I've optimized all of your hormones as much as possible. We do antibody panels to see, do you have an immune response to things like gluten, or there are antibodies you can actually test for leaky brain. That's not necessarily a target for therapy, but just more informative. We do volumetrics MRIs where we actually can measure the volume of the hippocampus and the amygdala, the 2 structures of the brain that are most affected by Alzheimer's, and we can track them over time to see if we've improved hippocampal volume, and the program has actually been shown to actually increase the volume of the hippocampus, which is profound in the area of Alzheimer's.
So one of the holes that you mentioned was heavy metals and glyphosates. I am so confused about heavy metals, identifying them, and then what one does to get those out of the body. I keep hearing the words forever chemicals about glyphosate and all these others, and it just kind of makes you think, well, I've been exposed. There's really nothing I can do to get them out of my body. They're going to be there forever. And gee, what do you do when you discover someone has elevated heavy metals in their body, or they've got glyphosate or other things you test for in that category? What are the things one can do to get those out of their body?
It is a very defeated mentality to call anything a forever chemical. Like, our body is beautifully designed to get rid of all this stuff.
Hope springs
Now,
eternal. Thank you.
I mean, we were never meant to have the level of exposure that we have today. Don't get me wrong. And so paramount to your health is to minimize your exposure.
Okay.
You cannot eat glyphosate. You cannot spray Roundup on your yard. You have to avoid heavy metals. And so part of the program is educating people, like, where would I come into contact with
Outstanding.
glyphosate? Where would I get mercury in my diet? How would I ever be exposed to lead? So that you can absolutely cut out all exposure. If you already have it in your system, again, you were beautifully designed to get rid of it. Just our world suppresses these detoxification pathways they have to be working in a pristine manner to get it all out, but they can get it all out. Metals specifically can sometimes require chelation. I do IV chelation in my practice. I also use a lot of Quicksilver Scientific. They're probably the leaders in the world for detox products and protocols that can augment your detoxification pathways. They're right in a suburb north of Denver in Colorado. A great company. I use a lot of their detox systems. And a detox system basically upregulates all of those pathways in our body that are designed to get these toxins out and bind up the toxins in the gut and eliminate them from the body. And so it's possible to get them out. Metals may need to be chelated.
Well, we have some pretty savvy viewers, but something I learned a while back that I think is very important for our viewers to understand is when you mention avoiding glyphosate, a lot of people are going, I'm eating the rainbow. And I'm like, wait, if you're doing things that are conventional farming, most people don't realize that when they're harvesting grains and vegetables through the normal strip farming methods that are used out there, the conventional agro world that uses pesticides, the glyphosate is actually sprayed on those to dry them. Mm-hmm. And so if you're not moving into this world of eating organic and identifying the level of organic, look up organic certifications so you can kind of get an education about that. People may think, man, I'm eating 3 salads a day and I'm eating the rainbow and doing all these things, and yet they're exposing their body in a profound way to glyphosate. Yes,
definitely eat organic. I actually love the environmental working group, Clean 15 and Dirty Dozen. They put it out every year. I think it's pretty accurate representation of foods that you may be able to not do organic, and then foods that you absolutely have to do organic. And I like that because the reality is that organic produce is super expensive. And if you can make choices that help you to really avoid the problem things. A general rule of thumb is if it has a peel and you're going to remove it, you don't necessarily have to go organic. Bananas, avocados. If it has like cracks and crevices in it where all the glyphosate can go and you're never going to get it out washing it, like a raspberry or a strawberry, you better be eating organic because those things are loaded with glyphosate if they're not organic. And then wash your produce.
Yeah, I actually learned a trick way back in the day that you can, take a nice little plastic tub and you can actually open up a betaine HCl, hydrochloric acid capsule. You put that in the water, and then when you're washing your vegetables in that, it profoundly will take pesticides and stuff off of that. Kind of interesting,
huh? I had no idea. I will totally do that.
I know. I learned that from a kinesiologist way back in the day in California, and it was brilliant, and I did it forever and got away from it when I started eating all organic. So I understand in the Recode protocol, the words personalized and precision are just repeated over and over and over. And you've already said there is a lot of tests that can be done. But I mean, I'm thinking to myself, if you're out there and you have a loved one that you're seeing moving on to this cognitive decline, dementia, Alzheimer's road, why not take an approach like this? Because you heard Dr. Bargas mention that all of these hundreds of pharmaceutical drugs have still, what did you say, basically have not proven to be able to help yet. So you have an actual path and a roadmap for an individuals to start at any place in the game, whether they want to prevent or whether they're in the thick of it. And I've heard our good friend Keith Bishop mention before how critical it is for someone to have, in essence, kind of a partner to help. Because if a person starts to go into cognitive decline, before long, they may not be able to open their email, or they may end up in the bathroom and wonder why they were there, or in the kitchen, or the spouse wakes up in the night and goes, "Where's my mate?" and then finds them in another area of the house scratching their head. So how critical is something like that in this process? And I'm saying this because I want to incentivize viewers to notice, look for the signs, and then say, you know what, we're going to go do this.
It is so important, Josh. I just had a meeting yesterday with my health coach. I have the benefit of having a functionally certified health coach in my practice,
Awesome.
One of the only ones in Oklahoma, and she's very familiar with my Recode protocol. Her name is Sue, and I could not successfully be a Recode provider without her. And so the program, I mentioned how we do all these tests, and It's easy for me to tell you, take your zinc, do this detox, let's put you on some hormones. But the actual protocol is you have to change your whole entire life usually. Now, some people come to it already doing a lot of the right things, but usually you don't get significant cognitive decline if you have been always eating a whole foods organic diet and exercising every day and sleeping well. And so the actual program includes many foundational aspects that's very functional medicine-esque. You have to eat the right things. Now, the biggest change in the diet is that you want to be in ketosis. And so if you want to optimize the health of your brain cells, you cannot eat carbohydrates and sugar. You want to get into ketosis. People are checking their ketone levels. We want a level of beta-hydroxybutyrate to know that you are doing everything you can to optimize the function, the energy and function of all of your brain cells. And so that's very difficult for people to look at that and be like, am I going to be able to change my diet enough to be in ketosis for the rest of my life?
Well, and let's talk about that for a second, because I know there is ketogenic diets, and then as I was on for about 3 months, a therapeutic ketogenic diet, which was even limited on protein as well as carbohydrates. And then there's the carnivores, which I see many people resolving all kinds of issues by going on a carnivore diet, doing it the right way. There's great resources out there. But I look at carnivore much more as a therapeutic, not a life diet. That's just me. I know some people that have been on it 15 or 20 years, and they seem to be the most healthy individuals in the world.
I have not seen those people.
Okay. And then also...
you need vegetables and the rainbow. You have to.
Great. And how about this? How about intermittent fasting? Because if you're going 16 hours without food, maybe eating one beautifully balanced meal a day, you're really hitting that ketosis zone for several hours, right?
Well, we don't guess, we test. And so we will measure ketone levels. Intermittent fasting is a huge part of the program, or it's technically time restricted eating if you're minding a narrow window for when you consume all of your calories. So there is a very specific meal plan. It's called Ketoflex 12 and 3. So it's not Atkins ketogenic. It's not carnivore.
Give us a synopsis
it's a very specific meal plan.
Of the macro, micros in that, and the balance of those, and what that looks like.
So people typically start out in a 65% fat and the rest is balanced protein and
And
carbs.
explain for our viewers what you mean by fat, because a lot of people are going to think, oh, canola oil and seed oils and these things and stuff.
So,
tell us what healthy fats really are.
Yeah, healthy fats are extra virgin, first cold pressed organic olive oil, coconut oil, avocado oil, pasture raised ghee, not inflammatory fats. Obviously, if you eat a lot of inflammatory fats, you're defeating the purpose because you are going to cause a lot of inflammation, which is where I tend to have issues with the carnivore diet, because you're not taking in any anti-inflammatory if you're not eating vegetables. Meat is a condiment in this meal plan, yet 65% or greater of your calories you consume are fat. And so that's hard to wrap your head around. Dr. Bredesen wrote a whole book just about the meal plan. It's complicated, and it's a difficult switch for people.
Yeah.
But basically, you fill 3/4 or more of your plate with healthy vegetables and a serving of high quality protein.
So can we bust a myth here? Because I've got a lot of Native American background, and I was vegan for a period of time, and then I was lacto vegetarian, and then I was lacto ovo vegetarian. Never really felt quite right doing all that. When I actually began to embrace beef, and I will only eat grass-fed beef of the highest quality. Yes, it's expensive. Boy, is it satisfying, though. It fills me more. But
Buffalo is a great option,
yes,
too.
but fat within those types of meat, and I know buffalo is very lean, but fat within those types of meats is not bad for you, coming from a cardiologist perspective,
I think it's good
right?
for you.
Thank you for saying that.
Animals were created for human consumption.
And let's talk maybe about grass-fed butter as something. Again, it's actually considered a healthy fat by a board-certified cardiologist that is a functional medicine specialist. Okay.
It is, but you can't be eating margarine, God help us all,
right,
or these refined seed oils, soybean oil that is in everything that comes in
canola,
a box
rapeseed.
or a bag.
I go through my health food store.
Corn. You can't eat any of that.
It's all
if
over
it
health
says
food
refined,
store products.
Yeah, it's not, you can't eat it. That's not a healthy fat. Avocados, eggs, I'm a huge proponent of eggs. It's a great way to get your protein and fat. If you can tolerate them, there is a lot of intolerance to chicken eggs. Those nuts, very good source of healthy fat, but you can't buy nuts that are deep fried in soybean oil. You gotta buy like dry roasted. It can't have soybean oil or it's inflammatory.
It's hard to find nuts that actually are not rancid on a store shelf. That's why one of the places I like to shop keeps them basically frozen. So that when I get them in the bags that I get them, they basically were thrown into the cold thing, shipped cold, and then they're cold, because nuts do get rancid really quickly, and a lot of people overeat nuts too. That's kind of a problem, You don't need to eat 2 handfuls of them and say, "Whoa, I'm just being really healthy with my body." So for you, how many, just a ballpark figure, how long have you been doing the Recode protocol as a practitioner under the Bredesen protocol? And then how many people have you actually worked with? And give us an idea of some of the things you've seen, because you've mentioned some hard things, which I know that about you. Do the work, right? But people can take baby steps in these things as well and begin to get better. But if somebody's going to engage, cognitive decline is coming on. How many people do you think you've taken through this? And I know you know a lot of other practitioners too, so you can draw from that pool. How many people do you think you've taken through this? And what are some of the types of things you see when people embrace the Recode protocol, and how quickly do they begin to see changes?
Okay, so my Recode and PRECODE practice is not huge. I mean, it's a highly specialized program that is not for the weary. And so I think right now I might have about 30 people in the program, and people have come and gone over the years. I think I've been doing it somewhere between 2 and 3 years. I've been a certified practitioner that I've really been like, people pick me when they sign up for Recode, that I was practicing this type of thing long before I became a Recode provider, but actually being in the program. And so I have probably, I don't know, I would have to look at my numbers. Maybe less than half are actually PRECODE, and so they don't have any element of cognitive decline. And so the big success with them is that all of their scores are staying normal. And so in order to know like how is somebody doing, they take pretty advanced cognitive, neurocognitive assessment tests. And then they just know in their life that they feel good and their memory isn't suffering. In my Recode patients, I mean, I won't lie. There have people that have come to me with MoCA scores, which is Montreal Cognitive Assessment. It's a 30-point in-office, pretty brief test that you do to quickly assess somebody's cognition. And if you come to me and your MoCA score is less than 10, highest being 30, anything less than, oh gosh, I should know this, maybe 20, less than 20 is dementia, somewhere between 20 and 25 is like mild cognitive impairment. Wow. If you come to me with a MoCA score of 10, it's going to be really hard. If you could do the entire program 100%, you may not decline from where you are. Maybe your score will go up a couple of points. But the problem with those people is that they're already so declined that you can't get them to exercise. You can't get them to do brain training exercise.
Right.
You can't get them to take all the supplements. And so it's so hard for them to comply with the program at that point, even with a really good support system. It's hard. Now, Dr. Bredesen has turned some of those patients around, and there's actually this amazing facility in Wichita called the Clear Mind Center, and it's a nursing facility. It's the second. The first one is called Marama, and that's in California. So it's in Clear Mind Center is just in Wichita, and so it's right down the road, and so it's kind of doable for patients. So it's a facility where people live and breathe 24/7 Recode. All of the meals are Recode compliant. It's amazing. Now it is not cheap, but either is a memory care center, and so I have had a couple of people go in there. Some have done better and some haven't. For me personally, when I'm implementing the protocol, it is really all about compliance and how much of the protocol can you do. And so I had one patient who came and she, like an example, she no longer managed her own finances. And when she first saw me, she hadn't actually written out her own check in over a year. And when she came to her second appointment after only 3 months on the protocol, and this is her just implementing it herself with her family at home, she literally wrote her check for her visit herself, which was just a testament to me, like it really can help. I have another patient who he has pretty significant cognitive decline, but he's brilliant and he owns an accounting firm. And so his executive functioning is very high, and his ability to communicate with his clients and stuff is high, but his memory is not good. And so when he first came to me, it was a very hard visit. That like there was a lot of crying in this visit. I was like, you have got to make your plan to protect your clients and protect your business and protect yourself and figure out a way out of this. And he's been with me now for a year, and he's still owns this business and still working, but he's kind of separated, taken himself out of like the critical jobs that could really affect a person's financial welfare, and does more of kind of the relationship.
Right.
And I thought about him when Adam talked about the professor that retired and 3 months later died. Like, I really actually don't know that I ever want this guy to stop working, because it's so much a part of his life and his satisfaction. And that's super important in the program as well. Community is really important, and surrounding yourself with people that improve your outlook on life. And his job is very important to that. But he's had the wherewithal to make the plans and appropriate decisions to protect himself and protect his clients. And he's exercising more, and he's like religious with the diet. Like, you tell him this, you can get meal plans actually ordered from a service that are Recode compliant, and he gets those and eats them. And he's doing great. He's improved a lot of his scores dramatically in the past year and a half or so. He's doing really well, and I think if he stays with the program, I think he'll do well.
So you've always, when something like this comes along, you have these opposing forces between what would be standard of care, the 200 drugs that you mentioned that don't work. And so there's going to be
there aren't
these
200 drugs to treat it. There've been over
Right.
200 studied.
Oh,
Let's
there
be
you
clear.
go. Okay,
there
thank
are
you
3
so
drugs
much.
on the market to
Okay,
treat.
gotcha. Thank you so much for that distinction. There's always going to be critics of something like this. I think I already know the answer to this question, but I want to hear it from you. You know, people are criticizing the Recode protocol, and they're doing the same thing they always do. There's not been any long-term randomized placebo-controlled trials, which you and I know can go into the hundreds of millions of dollars to do something like that. How would you respond to that? I mean, obviously, you just told us about case studies and results you're seeing when people embrace the protocol. But from a doctor's perspective that does deal in a hybrid practice with functional and some level of standard of care as well, how would you deal with those criticisms?
Yeah, I think that is fear. I think that it's a big pharma mentality that supports that philosophy that you need some sort of large-scale randomized placebo-controlled trial to
they can't afford
prove
them.
something.
They can afford them.
They can afford them, but the truth is this protocol can never be studied in that way because that kind of study design is to study one factor and keep
Right.
all other things the same.
Yep.
And so
You're
this
right.
program is
Yeah.
not one factor. That's what
Exactly.
makes it so different and, quite frankly, so effective. It's 100 factors all at once. And so the only way to study it would be to take a group of people with the same level of cognitive decline and all the same risk factors and put half of them in the protocol and half of them not.
Yeah, exactly.
And that's still not randomized double-blind placebo. There can be no blinding
Yeah,
in this protocol.
that's
You're
right.
either living the protocol or you're not. And so Dr. Bredesen is doing a good job of following his patients and publishing. Like, he wants this protocol to be mainstream and he wants it to be validated. And he published October 2023, I guess. He published like his 10 patients that had been doing the program for 10 years or something. I can't remember all the details of the study to show improvement. But there's no
Nice.
placebo.
Right,
And there's no like matched control.
Exactly.
It's just either it
You
works.
are
We
or
know
you
what
aren't.
happens if you don't do it.
Right, exactly.
It's pretty clear. And so the people that are going to stand back and say it doesn't work, they're just scared that
Right.
they're not going to take the pharmaceuticals or something. I don't know
Right.
what they're worried about. They're scared that they won't be able to they won't be able to implement the protocol. I don't know what they're worried about.
Okay, so last question, and thank you for that. That was great. There's a big buzzword in the supplement industry the last 3 years, and I know how these trends go in and out of the supplement industry. I, frankly, am very upset at times with the supplement industry because, to me, they're doing the same kind of ride that's happening in the other world that we're not very fond of at times. 30 to 50-somethings out there, and the word is nootropic or nootropic.
Right.
What are some of these things that one would find in nature? Let's for a second not talk about drugs. There probably are those that we know people are doing things with Adderall and all kinds of crazy things out there. But in the nootropic world that would be a supplement world, are there any things within your own practice that you have recognized are really key supplements that, let's say it's an individual that's not having any cognitive decline, not having dementia, but maybe they really want to tune up or sharpen their mind? Are there things in nature that you would recommend for people? And would you call those nootropics?
Nootropic is a total buzzword right now. I have never said the word nootropic in my practice ever. Okay.
Ooh, we caught you on film saying it for the first time.
Yes. So I don't really discuss nootropics necessarily with my patients. I definitely advise heavily against using any Adderall, amphetamine, stimulant type product. They're highly addictive and they are not going to be helpful in the long run.
Right.
And there's so much, I mean, don't even get me into like the fentanyl laced stuff out there.
Right.
You cannot be grabbing an Adderall from your college roommate because you can wake up dead. And it's happened. It's happened to close people to me. It is very bad. And so I would caution people, do not take those drugs.
Thank you for that.
Now, I also believe supplements are supplemental. And so I'm going to always, food first, and exercise is actually the most potent nootropic on the planet. It increases BDNF, it causes mental clarity. It's going to be the best way to support cognitive function in your brain. And then don't eat sugar and eat your vegetables. And that's going to be very important. As far as like, what do I pull out when I want to increase mental clarity in a young person? I use a lot of, I wouldn't say a lot. Well, one thing I would say is caffeine. Caffeine can be incredibly effective if you're not adversely affected by caffeine. It can cause, it obviously causes mental clarity and increases your energy level and can be very effective. I never use this, but nicotine is actually an amazing, you can really think straight.
I have heard of that.
But it's also highly addictive and very difficult. And certainly I don't want anybody addicted to nicotine, or certainly don't smoke. But it does cause a lot of, it's very good for mental clarity. And then I use glutathione. So glutathione is the most potent antioxidant in nature. And in our bodies, and a lot of us are deficient, and in a toxic world, we use up a lot of our glutathione. And there's a lot of controversy about how to administer glutathione. You can't swallow glutathione. So for anybody out there, if you're taking glutathione capsules, you are not getting any glutathione.
That's right.
You can't use it that way.
And N-acetylcysteine is something that can help to naturally elevate glutathione levels.
I use a lot of NAC. But if I want, I want to increase my focus right now. I have to give a lecture, or you're going to take a big test or something. You can really be on your game by taking liposomal glutathione. I administer intramuscular and IV glutathione in my clinic too, but it's not really practical for people. And so I use a great liposomal glutathione product. It's not super practical for long-term detox because you really do blast through that product within an hour or two. You've used it all up. But it can really be helpful for, wow, I feel amazing for an hour after I take this. And so I use that in a lot of my younger patients.
Are you familiar with Bacopa? Now, it doesn't work well for me, but I know people, when they take Bacopa, it is literally game on for about 3 hours.
Yeah. So the two other more botanical things would be, I use huperzine A and Bacopa monnieri.
I was hoping you were going to mention huperzine.
Yeah, those two things can really increase focus for ADD, ADHD, or just brain fog in general. Those are the two things that I really go to.
Yeah, and also for me, I love to utilize different types of ginseng that I will put together with others, and that creates for me a really good headspace, as well as a little increased physical endurance as well, which I really love. Well, you've been listening to Dr. Royce Bargas, Doctor of Osteopathy, board-certified cardiologist. You can contact Dr. Bargas really easily. BargasWellness.com, BARGAS wellness.com. I'm Josh Bellew. That's Dr. Bargas. This is Ultra Life Today. Do you like what we're doing? Please like, subscribe, share, give us 5 stars where you can. We'll see you next time.